Hi, this is Dave Racer again. Now what I'm going to say in a moment is going to use a doctor to tell a story, but this is a fictitious doctor. What you'll hear shortly about this doctor is that he's immoral, unethical, practices illegal behavior, and maybe he's even evil. But almost no doctors do what I'm about to tell you. Now I'm going to illustrate how the Affordable Care Act of 2010 throws ethics overboard to replace them with institutional behavior that would land a corporate leader in prison. Now for purposes of this story, we're going to call your Dr. Smith. And I want you to think about what would you do if Dr. Smith says, yeah, you have a sore finger. I want you to go across the hall to the Smith Radiological Center and get that MRI that you really need to find out if there's a problem with your finger. Now, unless you own a piece of Smith Radiology, you're probably going to be incensed at a doctor that would do that sort of thing, not because he owns another medical practice, but that he seems to be forcing you to use his facility. Now, let's try another and see what you think of this. The doctor looks at you and he says, that's really a nasty rash you have there. I want you to go to Dr. Jones, the dermatologist, to have her look at it. Now, he fails to tell you that Dr. Jones sends him $25 every time he does this. Now, if you knew that he got a kickback called fee splitting from Dr. Jones, you'd probably find 2 new doctors. Now, one more. Let's say you hurt your arm, your right arm, and your left foot. And Dr. Smith examines your right arm and says, well, you need this done and that done. Tomorrow, come on back, we'll look at your left foot. That way, I can charge you 2 office call fees, and don't worry about it. Your insurance is going to pay for it. I think that'd be the last straw. Goodbye, Dr. Smith. Now, Dr. Smith in this scenario is motivated to do as many procedures as possible to wrestle away health insurance money or your own. This is a nasty idea, and despite what big government planners want you to believe, the practice is extremely limited to a very small, tiny percentage of doctors. Now, if you discovered that Dr. Smith did self-referrals, fee splitting, and manipulated the system to get more than one office fee, you'd report him right away to President Obama, the FBI, and worse yet, maybe Nancy Pelosi. What an outrage this would be. The behavior is also illegal in most states, and certainly unethical, moral, and evil in all states until Congress passed the new health care law. An accountable care organization, called an ACO, an accountable care organization, is one of 3 linchpins of the new law. The other 2 are insurance exchanges and the inevitable reduction in the number of health insurance companies out there competing for your business. Now here's how the Accountable Care Organization, the ACO, works. Medicare and eventually all medical payers pay a flat fee to the ACO to pay for your medical services. Now, you have access to all the doctors and all the medical providers under contract or employed by your ACO. So if Dr. Smith is employed by or under contract to your ACO, he makes more money by providing fewer medical procedures. You see, the fewer procedures Dr. Smith does, the more money that's retained by his ACO, and ergo, his bonus is greater. Now, this is really the same thing that he was doing before that we used to call evil, but it's sort of done in reverse. Before, more medical care and more money. In the ACO, it's less medical care and more money. Less medical care and more money. Now, rather than fee split with a doctor friend, in the ACO, Dr. Smith now splits his fee with the ACO, and the federal government blesses him for it. When Dr. Smith sends you to a dermatologist or radiologist under contract with his ACO, or they work for his ACO, he gets a gold medal for sticking to the plan, and incidentally, the ACO gets paid. Now, it's true that Dr. Smith would probably examine both your arm and leg at the same time in this plan, but he'd do it very quickly, or more likely, the ACO would have nurse practitioner Johnson or physician's assistant Peterson see you. They cost the ACO less, and they leave more on the table for Dr. Smith. Now, studies show, and this is going to really amaze you, that when doctors work under contract or they are employed by a healthcare organization, their productivity falls dramatically, often as much as 50%. In the new ACO, then, Dr. Smith gets to work for less, make more, and still be able to self-refer and fee split, plus get backdoor fees from his ACO fees or peers. What a deal that is. Now, the federal reformers tell you the ACO is a better way to deliver health care than a fee-for-service plan. Now, it's true if your doctor is immoral, evil, and unethical like an ACO. That is true. The purpose of the ACO is to consolidate services in a closed system to cut cost. While it may be true it would be more effective in helping people with chronic illness get more coordinated care, it does so using the very reimbursement arrangements it labels illegal or immoral when it's done by individual doctors. ACOs that rely on self-referral and fee splitting, which they do, should be judged by the same standard you used on Dr. Smith, don't you think? But if you complain to President Obama about this one, he will call you out, and Nancy Pelosi will whine and shake her finger at you. Now, over time, I plan to share the 50,000-foot picture of the ultimate intent of ACOs and exchanges and massive coordination of care and insurance. Just stay well, please.